Good afternoon. In today's episode of Fact or Fiction, we'll be talking about mental health and homelessness. Today we have a great panel up here of our 5 contestants that will give their expertise to knock this out and help solve our homelessness problem. So let's get started. Fact or fiction? Currently, no one is providing services for the mentally ill, unhoused population in Rockford area.
I know this one. Facts. Nobody's helping anybody in Rockford.
Horrible answer, good try. Next person. Does anybody have the right answer? Andrew.
The Winnebago County Community Mental Health Board funds the City of Rockford's Impact Program. The Impact Program has employees that go out into the community and meet the homeless people where they are to provide service. These people would not be provided service if they did not go out into the community to meet them. The Impact Program also works with PATH from Rosecrans, MIH, and the Crisis Co-Response Team.
Fact or fiction? The Impact Program doesn't actually have housing of their own to place people in.
I know this one for sure.
Ellie.
That's facts. They do not have any housing.
And does anyone have the right answer? Marie.
I think that the right answer is through the Impact Program. We have temporary housing units. We have 8 temporary housing units, and we are able to reach out to these people in the community and get them services and remove barriers to get them housed permanently in the future.
Great answer, Marie. Fact or fiction? All homeless people are all drug addicts or mentally ill.
Ooh.
Ellie.
Yes, that's true. Because I keep up with Facebook very regularly, and everyone on Facebook says that.
Absolutely not. Sorry guys, she made me pull my hair out. Please hold it back in. All right, does anybody have the right answer?
Yes.
Jerry.
First off, Ellie, stuff on Facebook isn't all true. Homelessness can happen to anyone.
Really?
Job loss, the price of rent nowadays, the wage increases, that doesn't happen.
I guess that's true.
Fact or fiction? Landlords don't need to know what's going on with the participants prior to moving them in.
Oh my God.
What?
Again.
I know this one for real, guys.
Go ahead. What's your answer?
That's true. I don't think a landlord needs to know anything about what I got going on.
Yeah.
It's none of their
Really?
business.
So that's
I
what
can
it
have
is?
cats.
That's
I
what it
can
is?
have 10 people living in my house.
It's true. What's true? You're fired. You're fired. Next person. Anybody else have an answer? No.
We strive to make sure that our clients' confidentiality is taken care of, but we want to make sure that landlords are consistently briefed on what the clients are going into their places are doing. So the landlord engagement program was created to ensure that we are a liaison between the client, the case manager, and basically the landlord. And basically that gives the landlord the opportunity to reach out to somebody, either the case manager, or they can go direct with the landlord engagement specialist who has developed a solid relationship with them.
Great answer. Fact or fiction? Homeless people need to get a job, then they can pay their rent. Please, not you again.
I got this
Okay,
one.
Ellie.
This is fact and fiction. Well, of course it's easier to pay rent once you have a job. Not all jobs pay enough for the rent prices these days.
The rent prices are crazy right now.
They want you to have credit scores 800.
3 times your rent for your deposit.
Andrew drove, chime in.
And we have job services that can help them get jobs.
But also, there are a lot of rental assistance programs offered in the city to try to help people who don't have jobs or don't make enough.
Yeah, help them with their deposit, first month's rent, as long as they're working towards something.
We're there to support them.
Great job, Elliot. Everybody give Elliot a hand clap.
Since last summer, our Impact Program has helped 65 individuals aged 18 to 65 plus.
The 65 individuals who were previously unhoused and suffering from mental illness. We assisted them in getting secure housing and mental health support. Out of all the individuals actually in our program,
Almost 50% have gotten their own unit or been reconnected with friends or family.